It's 10:46 p.m. and your son is talking a million miles a minute about the fastest RC cars he's seen online. You're trying your best to get him to settle down, but it all seems futile. Attention Deficit Hyperactive Disorder, ADHD, is the most common neurodevelopmental disorder in children. Children with ADHD experience frustrating symptoms in all aspects of their life. They suffer behavioral problems, such as difficulty staying focused, involuntary hyperactivity, and sleep disturbances, like difficulty maintaining sleep and delayed sleep onset. Keep watching to learn more about ADHD and sleep disorders in kids, its diagnosis, and management tips. What sleep disorders are common with ADHD? Studies have shown that over 70% of children with ADHD suffer from disrupted sleep patterns. This percentage may vary depending on the type of study or measurement used. According to these studies, sleep disturbance can manifest as 6 possible symptoms. 1. Bedtime resistance. 2. Delayed sleep onset. 3. Fragmented sleep. 4. Difficulty waking up. 5. Daytime sleepiness. 6. Sleep-related breathing problems, such as obstructive sleep apnea. A child with ADHD and associated sleep disorders may experience unnatural alertness and trouble falling asleep quickly. They may wake frequently and suffer from parasomnias like sleepwalking and bedwetting. What's the pathophysiology? ADHD and sleep disorders have a complex relationship. Some unfavorable environmental factors like poor sleep habits, noise, or bright lights can make the symptoms of ADHD worse. Since stimulants are sometimes prescribed for ADHD, certain medications can worsen and may make it harder to fall asleep. Comorbid, coexisting psychiatric and physical conditions may also contribute to sleep problems. Insufficient sleep amplifies the existing symptoms of ADHD. People with ADHD experience fatigue and drowsiness, making it hard for them to focus and pay attention. These factors negatively affect their learning ability and cause increased impulsiveness and poor behavior. Several medications can be prescribed for children with ADHD. Unfortunately, the side effects of these drugs may outweigh their therapeutic benefits. These medications are grouped into 2 categories. 1. Stimulant medications. Stimulants like Ritalin and Adderall are prescribed to increase alertness, energy, and attention. Though stimulants help manage energy and focus, they can also disrupt sleep by delaying the time and duration of regular sleep. 2. Non-stimulant medications. Some patients are prescribed non-stimulant medications for the clinical management of ADHD. A particular drug called atomoxetine is a non-stimulant that treats symptoms, improves sleep quality, and increases drowsiness in children. What's the link between circadian rhythm and ADHD? Studies have shown that children with ADHD who also have chronic idiopathic sleep onset insomnia often experience delayed sleep phase and delayed dim light melatonin onset, compared to children with ADHD without sleep onset insomnia. After age 5, sleep-wake cycles may become sporadic and irregular, especially on the weekends when days aren't as structured and kids are more likely to take naps. This pattern comprises the criteria of sleep-wake rhythm disorder, which is when the body's natural circadian system fails to deliver a typical schedule of waking and sleeping. Keep watching, because we're going to talk about diagnosis and some tips to help manage sleeplessness in kiddos with ADHD. How are kids diagnosed? In some cases, ADHD can be diagnosed where inadequate sleep is the primary issue. However, the condition may be treatable and reversible if the underlying sleep issue is diagnosed correctly and treated. As a result, children undergoing ADHD evaluation should have a focused clinical assessment for common primary sleep disorders, such as obstructive sleep apnea, restless leg syndrome, or periodic limb movement disorder. Children and adolescents with ADHD are more likely to have a higher rate of comorbidity with psychiatric disorders, such as oppositional defiance disorder, depression, anxiety, and substance abuse. What are tips for management? To effectively manage concurring ADHD and sleep disorders, the child's developmental and behavioral needs should be considered when developing an individualized treatment plan. A couple of these approaches include: 1. Cognitive behavioral therapy, pharmacological therapy, or supplementation. Adjust ADHD medications to suit the need of your little one. This may require a change in dosage, adding a new psychostimulant, or switching to a non-stimulant medication. Take medications like supplemental melatonin at bedtime to help increase the child's hormone levels. 2. Adopt healthy sleep hygiene practices. Healthy sleep hygiene includes developing a regular bedtime routine, like having a hot bath, reading a book, or doing light stretches. It's also beneficial to establish and maintain a sleep and wake schedule to reset and stabilize the circadian rhythm. To properly coordinate care and pursue the optimum health and development of your child, it's important to communicate with your provider regarding any coexisting physical, psychiatric, and environmental conditions. What's the conclusion? It's best to consult your child's physician for diagnosis, treatment, and management options if your child is experiencing symptoms of ADHD or sleeplessness. Help is available.